Hey, do you have gaps between your teeth, especially the front ones? And have you always been unhappy about it, especially because of the way your smile looks? So, if you're looking for solutions to get these gaps closed, then do watch the video till the very end because we are going to be discussing a lot of options there are in order for a smile transformation and a beautiful smile makeover. But before we dive into it, let me take a moment to introduce myself. I'm Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic, Mumbai. If you haven't already subscribed to my channel, then please do so, and don't forget to press the bell icon in order to get regular updates and notifications. So with no further delay, let's start talking about what options there are in order to achieve that beautiful gap closure. There's basically two methods or two approaches you can say when you're looking to get that perfect gap closure. One, you can either consider bringing in the teeth together or approximating them in order to close these gaps. And the second method or the second ideology, you can increase the width or widen the existing teeth in order to fill up those gaps. So let's discuss both of these techniques one after the other. So let's talk about the first technique, and that is bringing the teeth closer to one another in order to fill the gaps. Now this technique or this ideology works best if you have spaces present all over your mouth, or as we term it as generalized spacing, and if also the spaces are too wide. So if you're happy with the size, shape and color of your existing teeth, but you're just looking for gap closure, then this should be your ideal choice of treatment. And the way we can achieve this is by braces or orthodontics. I know when I say braces or orthodontics, most of you are thinking, no, I don't want to sport that metallic smile. I don't want pokey wires. But let me tell you, I think you'll have not heard about the latest advances that we now have in the field of dentistry and orthodontics. We have a wide variety of options, all the way from ceramic to lingual to invisible. And I'm sure that there is the ideal one suitable for each one of you based on your aesthetic requirements and your budget. So don't just give orthodontics away thinking it's not for you. It might be just the right and the ideal treatment for you. Just look into all the options and discuss it with your dentist. With each treatment option that we are going to discuss in this video, I'm going to be talking about two things: the upside or the good side, and also the downside of this particular type of treatment. So when it comes to orthodontics, the plus side or the upside is, of course, main thing being that we don't touch your existing teeth. We just let them be naturally as they are. We are not reshaping them or taking away any amount of enamel from them, but we are just bringing them closer. And this technique also works the best if you have other dental issues or alignment issues, like say your teeth are flared, maybe they're too proclined and you're unhappy about their alignment as well. Then with orthodontics, you can achieve not just your gap closure, but also correct your teeth alignment. So it would be like a win-win situation, and you must go in for braces. Now, having said that, what's the downside? So the downside is that this particular type of treatment or braces would require slightly longer duration of time period to achieve the smile that you are looking for. So it's not like you put your braces and bang, in 1 month you're going to have that perfect smile. No, it doesn't happen that way. It will take anywhere between say 9 months to 15 months. That's the usual period of time that one takes in order to get the ideal or the desired amount of tooth movement. But of course, even this varies depending on a lot of factors like your age, the amount of gaps that are present in your mouth, and a lot more. So these things also need to be put into consideration or factored in before we begin the treatment. And hence I say that before you start braces or orthodontics, it is vital that you take a detailed consultation with your dentist and understand all the pros and cons of it. So now, having spoken about the first technique, which is bringing the teeth closer to one another, let's move on to the next technique or the next ideology, which is increasing the tooth width or making them wider in order to achieve this gap closure. So in this technique, some artificial materials are used to achieve gap closure, and the teeth appear a little wider, or we increase their width in order to close the gaps. This would not or should not be your ideal choice of treatment if your gaps are very wide in nature, say anywhere which is 2 or 3 millimeters or even more than that. In this situation, you should opt for orthodontics or braces, because increasing the width anywhere beyond that much will draw a lot of unnatural attention to your teeth when you smile. They will look a little unnatural. So if your gaps are 1 to 2 mm, then probably widening the teeth and this approach works best. But anything beyond 2 or 2.5 mm, I think it's best to opt for orthodontics. So even in this one, there's 2 ways how you can achieve increasing the width of your existing teeth. So let's start and talk about them one after the other. The first one, it's by the use of cosmetic dental fillings. So as the name suggests, these are cosmetic resin-based filling materials which we use in order to increase the width of your tooth. These resin materials are available in a wide variety of shades and colors so that we achieve that perfect color match with your existing natural teeth, and they don't look like they're artificially built up or made up. We make them as close to natural as possible. This is a beautiful, beautiful technique, one of my favorites for those who are looking for a very quick smile makeover. So let's discuss what are the good sides and what are the downsides of this particular type of treatment. The good side is, as I said, it is very quick and almost instant, you can say. The hands of a skilled cosmetic dentist, you can achieve this type of smile makeover in just one dental appointment. Of course, the time period will vary depending on how many gaps there are and how many teeth need to be built up upon. So every tooth, you can say, roughly requires about half an hour to 45 minutes of job, and then another little bit more for the polishing, etc. But if you have 3 or 4 teeth, then maybe in a couple of hours you can achieve that beautiful final result in just one sitting. Isn't that amazing? And the other good side is it is very, very economical. So it is certainly the cheapest option from all the 3 that we are going to be discussing today. So it's cheaper than braces and also cheaper than the third option that we are going to discuss. So yes, that's why it gets a big thumbs up from me, and it's one of the most popular techniques. The downside to this particular type of treatment is that it's not permanent. It's like a semi-permanent thing. So what do I mean by that is you will have to visit your dentist in the future for follow-up and maintenance appointments. See, we need to understand that resin basically is a porous material, and it does tend to stay over a period of time, especially from the tea and coffee and the other foodstuffs that we have, which are rich in food colors. So in order to maintain it just like how it was before and keep it nice and sparkly, you will have to make that follow-up visit. And it also tends to chip a little from time to time with regular wear and tear because it is not as strong as dental ceramic. So we need to bear in mind these downsides before you dive into and opt for this type of treatment. But let me tell you, with regular follow-ups and maintenance, I'm sure it's going to be easy and you will be happy with the results. So now, having understood about dental fillings, let's talk about the second technique there is in order to widen teeth. And this is nothing but ceramic veneers. As the name rightly suggests, it's a veneer which is made up of very superior quality of dental ceramic. A veneer basically looks something like this. It is very, very thin layer of ceramic which is further bonded onto your existing teeth in order to correct its size, shape, as well as close the gaps. This is a beautiful technique and one of the most advanced techniques that we have today in dentistry. Ceramic veneers are an excellent aid to get a complete smile makeovers. They are complete game changers when it comes to aesthetic dentistry. So you're not happy with the size, shape, or even the color of your teeth, then yes, all these changes can be incorporated into these veneers so that the end result is a beautiful, gorgeous smile. It's a fairly simple process and it requires just 2 dental appointments, which could be placed, say, about a week apart. In your first dental appointment, when you visit the dentist, some changes will be made to your existing tooth structure in order to accept or accommodate that veneer. And once these changes are in place, the dentist will choose either to make physical molds and samples of your jaw set, or some dentists also alternately take scans of your existing teeth and jaws. And this data is further sent to the dental laboratory where the actual process of fabrication of these veneers takes place. Once the veneers are fabricated and sent back to us, the trials happen, and once the trials are approved, These veneers are bonded to your existing teeth. They literally adhere or bond to your existing tooth structure, and they're so natural that one completely forgets you even have something artificial on, and it is very, very easy to maintain it too. So now let's talk about the favorite thing, the top side or the good side and the downside. So the good side is that these are almost permanent, you can say. They barely require any maintenance apart from the annual cleaning sessions, etc. Secondly, they're fairly quick. Just 2 dental appointments spaced a week or 10 days max apart, and you can achieve that beautiful smile makeover. But the little downside here is that your teeth require to be prepped a bit. A little amount of enamel will be shaved off, something which is as little as 0.2 to 0.5 mm, because that's literally how thin the veneers are. That much needs to be shaved off in order to incorporate the veneer. But frankly, it doesn't really have any side effects in the long run, and I don't see this as a reason to why somebody should not opt for beautiful cosmetic veneers. The other downside is that they are certainly expensive. If you're comparing with dental fillings, it could be at least say 4 to even 5 times more expensive than that, and they will require minimum 2 appointments. So yes, all these factors have to be weighed in, and then you need to make the choice as per whatever suits best to you. So to sum all of this quickly, let's talk about all these 3 techniques a little by little. Number 1, braces or orthodontics. This is best for those of you who have generalized spacing, who are looking for other alignment issues, say if your teeth are frayed or they're a little proclined, and for those of you who are happy with your size, shape and color of your teeth and not looking to touch your existing teeth. Then go for braces, you'll love the results. The second technique, which is cosmetic fillings, best for those of you who are looking for a quick smile makeover before an important day or an important event which is coming up, and say you don't have the time for braces, and also if you find veneers to be too expensive, then this is the middle technique and this will be best for you. Just remember that you need to make those additional follow-up appointments. Don't skip on that if you want your fillings to look as good as new and maintain them always. And the third, which is dental veneers, best for those of you who are looking for a complete makeover, not just closure of gaps, but also looking to correct the size and the color of your teeth alongside. These are best because they are very quick, very easy to maintain, and they don't really require any major follow-ups for it too. So that's all about closing gaps. I hope I've helped you gain a little bit more insight on how to get that beautiful smile and achieve a gap closure. If you have any further questions, then please leave them in the comments below. Don't forget to hit the like button if you liked what you heard, because this will encourage me to make such more videos and more content. Until next time, stay healthy and keep smiling.